Have you or one of your friends ever watched Grey's Anatomy? Well, if you have, you've probably seen an example of drug diversion.
Save for the loss. Have you been drinking?
Where the hell do you get off accusing me of something like that?
George, you're out of line. There is a 2-year-old girl on this table.
I don't need some punk intern telling me what's at stake here. Get him out of here, Shep.
You're out, George. You damn well better be ready, Taylor.
I wouldn't be here if I wasn't.
The branches of the artery need to be coagulated and divided.
Taylor, her anesthesia is awful light. Come on, Taylor, she's waking up.
He's asleep.
Dr. Taylor!
Oh, God. Sorry. I'm on it. My bad, Shep.
He was right, wasn't he?
I'll be fine. It won't happen again.
Get out of here and get it together. No, there is a code among doctors. We're not supposed to ask each other questions.
Okay, I was out of line.
I was out of line. Somebody should have taken responsibility, and it should have been the guy doing the cutting. It should have been me. You didn't deserve what happened to you today. You did the right thing. Code or no code.
In this video, one of the surgeons, George, calls out an anesthesiologist who is a higher authority than George. Now, George was called out of line by publicly announcing his concerns, but it turns out that he was right. The anesthesiologist was drunk on the job while in an operation room. But what is drug diversion? Drug diversion can be defined as taking medications without a prescription, using medications for purposes other than prescribed, selling prescription drugs, altering prescriptions, and being under the influence during a job. From the previous video, we can see that the term drug diversion doesn't just include medications and pills, it also includes alcohol on the job. Drug diversion spans across many different professions, but in a medical setting, anesthesiologists, ER doctors, and nurses have the worst records of drug diversion. Now, I can't go into detail about all three professions, so I'm going to have to stick with one, specifically nurses. Around 8 to 10% of nurses in New York have been diagnosed with some form of substance abuse problem. But how does being a nurse correlate with drug diversion? The nursing occupation has been documented as a stressful profession. Nurses have one of the highest stress jobs in today's market. They are usually the primary provider of their patients' care and are constantly on the front lines of a patient's battle for recovery. And despite every nurse's best efforts, a patient sometimes passes away. The stress caused by this environment can lead some nurses to use or abuse alcohol or illegal substances, and even to divert medication from their patients. Now, whoever you are or what your experience is, it is important to understand the legal and ethical implications that substance use, drug diversion, and related issues can have on your nursing license, your employer, your colleagues, and your patients. There are several important reasons why nurses should not practice under the influence of drugs or alcohol, including ethical concerns, the reputation of the nursing profession as a whole, and patient safety. It should go without saying that every nurse has a duty to provide competent care to his or her patients. A nurse's primary concern needs to be the well-being of his or her patients. Anything that compromises a nurse's ability to provide the required level of care can put a patient at risk. For example, patients can suffer from unrelieved pain, inadequate care, or infections from contaminated syringes. All of these and more can cause patient deaths. Drug diversion in a nursing department affects not only the involved employee and an organization, but also the employees within the department because it creates disorganization, demoralization, and promotion of feelings of betrayal among other nurses. A NE, nurse executive, must be cognizant of nurses who may potentially be impaired while caring for patients. These signs may often be subtle, but if left unrecognized, patient safety may be compromised and the organization placed at further risk. Nurses who are chemically independent may be successful at disguising dependency issues because they are often stellar employees, popular, respected, and bright. But coworkers are likely the first to notice impaired nurses' behaviors. Symptoms of impairment include increased absenteeism, tardiness, frequent or unexplained disappearance from the unit, lack of care and personal appearance, reduced productivity, and decreased alertness. Frequent reports of ineffective pain management by patients and inaccurate narcotic counts are also suggestive signs that the NE must pursue when nurses are suspected of drug diversion. The nurse executive also must be observant of nursing staff who are frequently volunteering to count or administer narcotics and are eager to relieve colleagues for lunch relief who have patients who are likely to receive pain medications. These nurses may likely be diverting medications, and if observed early, patients can be protective and problems can be averted. Now, I remember the first time I learned about the angel of death in sophomore year of high school. An angel of death is a phrase when in relation to nurses and doctors, or anyone in medical occupations, that murder their own patients. Based on this definition, drug diversion isn't just being under the influence while working. It also includes misusing drugs on patients. The three historical angel of deaths are Charles Colin, which you may have heard if you've ever watched The Good Nurse, Beverly Abbott, and Harold Shipman. These three serial killers used drug diversion by injecting patients with high doses of drugs. Charles Colin used digoxin and insulin. Beverly Abbott used insulin and air, and Harold Shipman used heroin. Now, there was no real motive found as to why these murderers did what they did. The closest we got was when Colin said he was alleviating undue pain and suffering of patients he felt were being treated inhumanely. However, many of his victims were not terminally ill and were expected to recover. Colin and Shipman were able to kill for years and years due to other nurses and doctors unable to see signs, since serial killers were not common at the time. It's very scary that they got away with so much for so long. If we knew sooner about the signs, then many deaths could have been prevented. Overall, healthcare nurses need to be aware of many things in the field, including the mental stress that the job can put on them, the signs of impairment, the limited psychological counseling services, how impairment affects patient care, how to report and support nurses if any suspicions arrive, and where to find drug abuse counseling.